Yeah, so I'll go ahead and get started. So I know many of you have probably heard lots about hormones as of late. It's kind of been much more of a buzzword since September of 2025 when they took the black box warning off of estrogen. So finally hormones are back and embraced, why they were not for 25 years is kind of crazy, but I'm going to get into that just a little bit too. But really tonight is just about a little different discussion because it's not always about the hormones. There's a lot we can do with our internal terrain in our body to allow hormones to work better, to also improve the hormones that we have in our body that we can actually increase the levels of if we need them to be increased. So really it's the internal terrain and what we do every single day that makes a huge difference. So we're going to talk about that a little bit too. So it's not always about the hormones specifically, especially for people in perimenopause or even before that in the fertile years. If people have bad periods, if women have bad periods, there's so much you can do with what you can focus on in your diet to help not have PMS as bad as it is. So that's where that whole internal terrain comes in. And so there's a lot we can do to kind of lay that foundation. And so today I'm also not going to just be talking about pushing hormones, that everybody needs to be on hormones. No, this is a conversation that everyone needs to have with their doctor. And now I feel like doctors are having the conversations more. Now some are still old school and still are thinking that the hormones are bad because of a study that was out in 2002 that they completely misinterpreted. And we'll talk about that a little bit. But that's why there was a hormone desert for about 25 years. And that has been probably one of the biggest injustices to women that I can even think of in the recent past. So a lot were dismissed with a lot of symptoms that you were having because doctors were not trained in medical school how to treat perimenopause and menopause because they kind of shut it down after that study came out. So it's evolving a lot. I know it's getting a lot of traction because some of the estradiol patches have been on back order. So we know you think the pharmaceutical companies would recognize that this would get some traction after they took the black box warning off. So now a lot of doctors are now prescribing them more. And doctors do need to make a point to get out there, take, some courses on how to do this correctly. So everybody is still doing it a little bit differently, but we know there's more than one way, and it really depends on the person and the type of route of administration that you want to. But the bottom line is you just have to have the conversation with your doctor. So definitely bring it up. But this is really to educate you on how to ask them, because we'll talk about routes of administration a little bit and different ways that things can be given. So with that, this is just my normal disclaimer I have to give because this is not medical advice. I'm really just educating you on this. So definitely talk to your doctor before you take any of this advice. And a little bit about me, for those of you who don't know me, I was in traditional medicine for over 25 years before I found functional medicine. And I knew then it was just the same thing over and over. We would diagnose a problem according to symptoms and then prescribe the medication that I was taught how to give, and what all the pharmaceuticals out there, we just gave them the drug for it. But we never really asked them, why is it happening to begin with? So that's really when I started to pivot and look for something a little bit different. And so really conventional medicine did teach me to treat symptoms, and functional medicine taught me to rebuild the systems that are underneath those symptoms. And so that's where we are a little bit different. And I'm just looking through a completely different lens now and really looking more at root cause. I still use all my medical knowledge, and I do know that was very important, everything that I have learned before. So I just, incorporate that into looking for root cause now and not just treating symptoms with medications. I do prescribe medicines, but just not very often. I de-prescribe more than I prescribe. And so that's really what made me become certified in functional medicine. And how I created my Renew framework. And you'll hear about my Renew framework a little bit tonight. Some of you know about it already. But the Renew framework is really, it's a deliberate stepwise approach so that you can improve your internal terrain. It rebuilds that foundation underneath. So anything that you do later down the road is going to work better. Whether it's a medication, whether it's a peptide, it doesn't make a difference what it is. It's all going to work better. And so it just allows us to remove the noise in the body. So it does give you space to heal, and your body can do it. We just need to give it the right tools is the bottom line. So Really, what are hormones? We are not going to talk about all of the hormones in the body because the endocrine system is very big. And so we're really going to be focusing more on the sex hormones, which happens to be estradiol, progesterone, testosterone, that sort of thing. But just know this is a big conversation because even our estrogen impacts our thyroid. Like everything talks to each other. This is a big spider web of how everything, if you pull on one side, something else moves on the other side, even though it seems to be completely unrelated. The gut and the brain are related. The gut and your hormones are related. So all of this is related. So we will just be focusing on those hormones, but just know the other ones, thyroid, insulin, all of it, they all are impacted by our hormones as well. So it's a big topic. And so really, it just shows the endocrine system there on the right-hand side. But what is a hormone? It's just a messenger. It gives your organs the message of what it needs to do. And we know that sometimes those messages get lost. And that's when we have a lot of noise going on and where there's kind of the internal terrain is a little messed up in the body. But the hormones actually coordinate mood, metabolism, sleep, energy, your menstrual cycles. That's kind of how it works. And also sleep cycles. It's impacted by everything that we do every single day. And so when it is disrupted, you feel it in every single system. But it's not just about the hormones, like I talk about. So some of the things that can impact our internal terrain are inflammation. Inflammation is kind of the name of the game with a lot of chronic disease. And so we know inflammation absolutely affects our hormones. Gut health absolutely impacts our hormones. Toxin load. I am going to talk a little bit about toxins tonight because I think we're hearing a lot more about that now because we are living in such a toxic world and people are becoming more aware of how we can control that. Stress level. Stress level is a biggie that gets ignored, very much so in traditional medicine, but it 100% impacts every endocrine system in your body. So it is a pretty important thing to focus on. And then sleep. Sleep is another big one that is a stealth problem that a lot of people think, oh, I'm good. I can just do 4 hours of sleep. I feel fine with 4 hours of sleep. No, you're going to pay the price at some point. And that's a restorative period that we really need to focus on. So that's part of the internal terrain. So again, laying the foundation first allows hormones to work better if you ever have to give hormones, but it also allows your hormones that are still there to work better and increase even if they're low. So you can make them move by lifestyle change. So that's the great thing about hormones is they're very sensitive to lifestyle changes. And so what are some signs of changing hormones or disrupted communication? Anybody recognize any of these? So it's fatigue, it's bloating, it's weight gain, weight loss resistance, insomnia, mood swings, you name it, all of that, just irregular and heavy periods. Again, there's a communication issue, even if you're just having PMS. A lot of times we can make that better too. But they're all just signs that your body's trying to tell you something. So we just need to listen a little bit better and just not trudge through it and feel like you're fine and you can just move forward and ignore what's going on. So there are lots of things that you can do to help these symptoms, and they are not a normal symptom of aging. So some of you may have gone to the doctor saying, I don't know, I'm not feeling like myself. And by the way, NFLM, not feeling like myself, is now a diagnosis for menopausal symptoms. Not kidding you. They did a research study on it. NFLM. It is one of the most common things that women say when they go into the doctor that used to get completely dismissed is NFLM. And usually you'd get a anxiety med or a sleep aid or something like that. So now you guys know to ask a different question and say, no, that's not it. This isn't me. I think we need to look at my hormones. So again, it's just a different discussion that we have now. But how did we get here today and why were so many females dismissed for so long? And you may still be getting dismissed simply because the doctors haven't fully come around. And unfortunately, it does take 17 years on average for any research to get back into the clinical world of medicine. So it takes a very long time. Functional medicine is a little different story. We do a lot of things based on more observational studies and not on the randomized controlled trials that everybody else, feels like you have to have before you can do something. And so I have a little different school of thought when it comes to that. But it was this study, it's the Women's Health Initiative study, the WHI study in 2002, that had to get stopped due to an increased risk of clots and breast cancer. And once that, it was unfortunately completely misinterpreted. The statistics were not even statistically significant, but the media got a hold of that. It got out and it just shut everything down completely. And so that's when women started to become afraid, doctors became afraid, and they stopped teaching medical students about this at all. So because you couldn't do anything about it, you can't prescribe hormones, so why even talk about it, right? So that's why women's got dismissed. And what is very important, and we're going to talk a little bit more about this, is synthetic hormones are completely different than what we are using today as more bioidentical type hormones that act like the hormones in your body. The ones that were problematic was the estrogens that they were using back in 2002 and the progestins that they were using in 2002. We are not using those today. When done properly, do they still exist? Yes. Why they still choose to prescribe those, I have no idea, because they're the problematic ones. So again, this is a different time and place, and many of the studies that came after the WHI study, even follow-up of the arm that they kept there, there was a decreased risk of breast cancer long-term, and an improved cardiovascular risk, improved osteoporosis, improved so many different things that it just kind of got brushed under the rug. I mean, it existed, that research is there, but it's just now that it's kind of coming back around. And so that's when that black box warning got placed on all estrogens. It doesn't even make a difference if it was a vaginal estradiol cream. It still said on there you could get breast cancer, Alzheimer's, clots, all the things. So it freaked everybody out. Nobody wanted to use it. And that is when just the treatment for perimenopause and menopause was completely ignored, and 60 million women were denied, like we talked about. It cost the U.S. $26 billion, mainly because of lost work, and all of the issues that women have, and the times they had to go to the doctor, and all of the things. I mean, it's been a big problem. And so again, all the positive benefits were sort of hidden behind all of that. And when they removed it, it's been changing. It is evolving. There's a lot more doctors now, and actually some of the FDA advisory board, there are a lot of more women who helped them understand why they needed to pull the black box warning. They are now teaching hormone courses, which is great, because doctors, two practitioners, because they need to know this information. So that's kind of how we got here. But let's talk about the synthetic versus the bioidentical hormones. I say a synthetic hormone is very much like a strawberry gummy. A gummy that has absolutely zero nutritional value, a bunch of sugar, a bunch of additives, all the chemicals, it's all artificial, versus a strawberry, which is your bioidentical hormones. So that is the big difference that we were talking about, from a synthetic hormone to a bioidentical hormone. So the synthetic ones, you can't measure them in your body. They have a completely different chemical structure. When we say estrogens and progestins, that's usually what it refers to. It's a little hard because estrogen is it's kind of a bigger name for other types of estrogens, which include estradiol, estrone, and some others. But essentially, just know that if somebody says progestin, that's not the real one. And that's more like, so Prempro, that's what they used in the study, was Prempro. So conjugated equine estrogen, that's synthetic. The medroxyprogesterone acetate, that's synthetic. And so they're much more potent than the bioidentical forms. So now what we're using today is just more like what's in our body, so we can measure it. We can follow the levels, which is great. And you'll hear different terms get thrown around. BHRT, they kind of don't like that anymore because they're like, well, not truly bioidentical. They just look like our hormones. I'm like, okay, it's just the semantics is what they're calling it. So now they just call it HRT. But it comes in different forms. You can have a transdermal estradiol patch, because it does get absorbed into the skin. There's creams, there's sprays, there's rings, there's oral forms of estrogen. I don't prefer the oral forms of estrogen simply because there is a slight increased risk of clots with anything oral, because it does this first pass through the liver. So that is something that there are so many different forms. Again, you just have to talk to your doctor about it, and it depends on the person, and how you actually want to take it. And both regular pharmacies and compounding pharmacies will carry these. So a lot of the creams, certain creams are still carried by our regular pharmacies as well as the patches. But if you need something specially compounded, then we go to the compounding pharmacies for that. And so what actually happens with our hormones in the perimenopause period? So this really starts even 10 years before menopause. So this is a roller coaster ride that women start to go on well before menopause. And that's when the not feeling like myself starts. It's the progesterone that decreases first. So that causes all kinds of mood stuff. The estrogen starts going up and down. So you'll have really high numbers and really low numbers. And so that's just part of it. Testosterone starts to decline. Yes, we have testosterone too, which is something that's been completely ignored in women, which is another thing I'm going to talk about. And it makes women feel like they're losing control because all of these things do affect our mood significantly. And the doctors don't know what to do with it. Your husband has no idea what to do with it. So like you really, like everybody's got to sort of like, they want to stay away from you during this time period, but there are things that you can do to help it and to make the transition a little bit easier. And again, this is the not feeling like myself, the NFLM that everybody feels well before you actually go through menopause, which the definition of menopause is just not having a period for 1 year. So again, this is happening well before that. And then the benefits of HRT, we're talking about, I mean, they have shown improved quality of life, improved cognition. We have estrogen receptors everywhere in the body. It is not just about, the sex organs. It is about every place in the body, including your brain. It is so important for our brain. Like your body wants to soak up as much estrogen as it possibly can. And so the brain is one of those areas that needs it. The bones too. So we know that with estrogen replacement therapy, you have a lower risk of osteoporosis, lower risk of cardiovascular disease, lower risk of colon cancer, lower risk of UTIs and sexual dysfunction. So all of that obviously is a pretty good reason to go on HRT, or at least have the discussion. And there are different routes. There's systemic routes, and then there are local routes. So systemic means it gets into your bloodstream and you can check levels. That's what like an estradiol patch is. That's what an oral form of estrogen is if you're using that way. It actually can get to all those receptors in all the different parts of the body. But if you're looking at a local cream, we're talking about a vaginal cream, that only works in the local area. So it does not get into your bloodstream. It's a really low dose and does not get into the bloodstream. So you have local effects. And actually, pretty much everybody should be on a local cream, a vaginal cream, when they're in menopause, simply because of the benefits that are associated with it, even improving mortality. And the mortality has to do with the decreased risk of UTIs. So even as we get older, that is one of the things that kills a lot of women is a urinary tract infection. And they have shown that it decreases the risk of UTIs by 40%, and mortality from UTI by 40%. So it's pretty significant. And obviously improves sexual dysfunction as well. And so we got progesterone and testosterone. So we talked about estradiol a little bit, but progesterone, typically I like to give it orally. It needs to be given orally if you still have a uterus and you're on any form of estrogen because it's protective of your uterus. So there's other ways to give progesterone, but just know that if you have a uterus and somebody's giving you a cream, it's not enough to protect your uterus. You really need to go on the oral form. Most women love the oral form. Not everybody. There is a percentage out there that they don't get some of these benefits that some of us do, but it really supports your sleep quality. It promotes a calming effect, and it's got this GABA effect. It's one of the neurotransmitters, and it may help with your mood and anxiety. So that's why I love an oral micronized progesterone. So that is the bioidentical form of it. You can get it at your regular pharmacy. Now, the regular pharmacy form actually has peanut oil in it. So if you're allergic to peanuts, you cannot have that kind. You need to go get it compounded. But the compounding pharmacies make this all the time, and you can have different dosages, and it doesn't have all the fillers and additives in there. So oral progesterone is great. People can use creams. Some people like to use the compounded creams, but just know it's not protecting your uterus at the same time. Testosterone. So testosterone is going to be probably one of these topics we will talk about for a long time. And when I prescribe testosterone for my females, they always get, the raised eyebrows from the pharmacist if we're trying to use the Testim, which is the male form of the gel that you can get at the pharmacy. But you only take 1/10 of the dose if you're a female. So that's why normally there's a couple different ways you can do the testosterone. You can do it as drops on your wrist and just rub it together when you go to bed. But the gel you can rub on your calf, and that's the one that you can get a cheaper GoodRx coupon to be able to get that Testim that's at the pharmacy, and they will give you, essentially you'll have a 10-month supply for maybe $100. And because you're only using 1/10 of the dose. Men, they'll use an entire tube on their chest. You use 1/10 of a tube on the back of your calf. So it's great. I mean, it supports your energy, motivation, muscle mass, libido, cognitive health. I mean, it's kind of, when women ask for it, we always need to try it. It's not like it's a have to, but it's a possibility. If you're feeling a little fatigued, if you're feeling like you can't build muscle in the gym and you're really trying hard, I mean, it does help. It gives you a little bit more pep in your step. So, and you don't have to go high. I think testosterone got a bad name because of pellets. I am not a pellet fan, simply because you can get on this roller coaster ride with pellets, because you'll get a really, really high level once they put it in, and then it really declines to almost to nothing before it's time to get another one. So you're still, I don't know, I don't like the roller coaster ride. Most women don't like that either, and that's the reason I don't love pellets. And it's just so easy to do the gels, so I kind of do that most of the time. So that's testosterone, but you're going to hear that it is, a bit controversial still, and it is not FDA approved, and I don't know when that's going to happen. So just know it's not about the hormone itself. It's not just about getting hormones. You've got to fix the internal terrain, because sometimes I tell my patients this all the time, like, I don't want to chase the symptoms with the hormone. You've got to fix the terrain first. We're going to stabilize it, and then you can add the hormone. Now we can give them the hormone early on for bad, symptoms and hot flashes and things like that. But just know the benefit is going to come when you affect the terrain as well, and laying that foundation first. And so what do I consider are the 5 biggest hormone hijackers? It is gut inflammation, which you guys may have heard about the gut microbiome. When I say dysbiosis here, dysbiosis is just the imbalance of the gut microbiome. We have trillions of bacteria that live with us all the time in our gut. They do all kinds of processes that we can't do by ourselves. We're actually more bacteria than we are human. And they are extremely important for the health of our entire body. And so that is something, there is a new book that just came out that a friend of mine just released called The Menopause Gut. I don't know if you guys have heard of it. I think it's about a week old now. I just got it downloaded on my phone. But Cynthia Thurlow, she's a nurse practitioner that has been specializing in this area, but it's called Menopause Gut, because your gut changes significantly during the perimenopause and menopause period. So if you're wondering, like, why am I constipated? Why am I having bloating? Why am I having all these issues now? I used to be fine. It's a thing. It's a thing with our hormones. So it all goes hand in hand. So I'm just going to throw my Renew in here again, because Renew stands for restore the gut, elevate the nutrient status, nourish the adrenals, eliminate toxins, and weigh in the balance the hormones. And I kind of have the hormones last. It's not that I don't do them at the same time, but we know that when things stabilize, you're able to put them on a little bit easier. So this is kind of that R part. So it's the gut inflammation and dysbiosis. Second, nutrient depletion. We know that if you have fatigue, brittle nails, hair loss, restless legs, all that stuff, that's just a sign that there is something going on with your nutrients. So, and most doctors will probably give you the medication for the restless legs. But my first thought is, okay, do you have iron deficiency anemia? Let's look at some of these other numbers, because that's usually what the cause is. Or are they cramps that you're getting, and it's a magnesium deficiency, because we're all depleted in magnesium now. But so that's where the nutrients come in, is that second E. And then adrenal overload. We were talking about adaptogens earlier with the mocktails that are coming. But stress is one of the most overlooked causes of chronic disease, and they say it's responsible for about 80% of doctors' visits. So it is has a huge impact on so much chronic disease. So if you're wired at night, tired in the morning, anxious, you have sugar cravings, all of that is part of our adrenals talking to us. Another hormone hijacker is toxins. So I'm going to get into toxins just a little bit more, but toxins can lead to more PMS, to headaches, to irritability, skin changes, weight loss resistance. EDCs are endocrine disrupting chemicals. So I'm going to talk about the EDCs, and you may have heard more and more about it because they're finally getting out there. Finally, companies are taking them out of their products. But I don't know what they're replacing them with, which is part of the problem. But toxins are a big problem for us. And then, of course, the broken model and the conventional narrative, which I now feel like is changing, because that was one of the biggest hormone hijackers before. But also just knowing how you can start to naturally balance your hormones is going to be key, because it doesn't always have to be from a drug itself. And so talking toxins for just a minute, are these EDCs. So you've heard of BPA. I don't know if you guys have or not, but bisphenol A, it's in our water bottles. It is in our receipts that you're handed at the grocery store. It actually gets absorbed into your skin. It lines the cans of beans that you get, or coconut milk, or whatever. It's in the lining of these cans. BPA is bad news, and I think it is probably responsible for our infertility epidemic that we have right now. But it's one of the many. I mean, it's not the only one. So it's BPA, it's phthalates, PFAs, dioxins, and PCBs. I mean, all of these you're welcome to look up. It probably will go down a rabbit hole that it's going to be hard to come out of. But essentially, we can inhale them, we eat them, we drink them, and then they get absorbed into our skin. But there are ways that we can start controlling this. And so really the top three, and those three that are highlighted at the top, are plastics. Any plastic that we have, just try to control your plastics at home. And I know sometimes you have to drink from a plastic water bottle when you're out and about, but always have either something that's metal or a glass container that you drink out of and make it good purified water. That's one way to avoid it. Also, nonstick cookware needs to go. Unless it's ceramic. So ceramic is kind of the way to go. The old nonstick cookware had all the PFAs in there, which are bad juju. And actually Mobile's water, they sent us something, I don't know, maybe it was about a year or two ago, that had a warning for our water with the amount of PFAs that were in there. I don't know if anybody else got that. I was already, I was double filtering my water at that point anyway, but our water is bad. Tap water is bad. We do need to be filtering it in one way, shape, or form. And it's also in our personal care products. So there's a lot of newer cosmetics coming out that are cleaner. Some of the stuff that's in cosmetics, you would die when you would look at this stuff. I mean, arsenic and lipstick, really? Like, why? Why would we have arsenic and lipstick? But, it's one of those things that you just have to pay attention to. And some of these really healthy organic cosmetics is probably going to be the way to go. Because there's xenoestrogens. They act like an estrogen in the body. And I think that's why breast cancer risk has gone up. I think that's why we're seeing breast cancer in men. I mean, it's a little scary because these xenoestrogens are impacting men just like they are impacting women. And again, it's part of the infertility issue too. This is what, obviously a bunch of estrogen in a man is not going to help his sperm swim very well or even produce sperm. So it's a problem, and really controlling where we can is going to be key. And, it starts in the home. And so all of these endocrine disruptors are associated with early menarche, girls getting their periods much earlier than they ever did before, early menopause, irregular periods, PCOS. I mean, all this stuff, thyroid problems, insulin problems. So it is a problem, and it's transgenerational. I feel like a lot of our increased rates of cancer probably have to do with this transgenerational effect of toxins, because now, and don't be too scared about it. No, we can control this somewhat, but those of us that were born to moms 50 years ago, we had a certain level of toxins in our bloodstream. Now that has gone way up. Umbilical cord blood, when a baby is born, they have hundreds of toxins in their bloodstream from mama, which is a little scary. So it's just becoming more and more of a phenomenon that we must address, simply because infertility is only on the rise. And if we stay on the same trajectory for what's happening to sperm counts, we will be at 0 by 2050, because it's that bad. And so that's why now finally the chemical industry is kind of being made to do some things, but we're nowhere close where we need to be. But it is that transgenerational effect that is a little scary, because we want to not give toxins to our baby. So you want to try to clean up your environment as much as you can so we can control that amount. And so how to reduce exposure. So like I was talking about, education is key. So you already know, you're thinking about how can I swap this stuff out? Look for BPA-free cosmetics, drink the filtered water, use an air purifier, ditch plastics. Like any plastic container that you have in your house that you put food in, toss it. Definitely toss it. Never heat in plastic either, because that's when it really happens and it just gets absorbed into your food. So those are just some simple things. Use stainless steel instead of the nonstick cookware. I do like the ceramic cookware. You can always look all these things up. There is a site called ewg.org. It's the Environmental Working Group, and they test all these products. So it's a good source that you can go to. And then in terms of supporting your body's natural ability to eliminate toxins, we got saunas. And actually breath work helps that too. Any form of sweating will help kind of eliminate toxins, but focusing on things that improve our detox pathways, broccoli sprouts, turmeric. You guys may have heard of that. High fiber food, it helps bind toxins and get them out. And definitely choosing whole unprocessed foods to help support that internal terrain. And the external terrain is like how we control toxins in our environment. So that's kind of where I bring that in. So just coming back to renew the foundations of what I like to build in order to be able to prescribe hormones or to do any of the other work that we need to do, it usually starts here. It starts with restoring the gut, elevating the nutrients, nourishing the adrenals, eliminating toxins, and weighing and balance the hormones. And so it is how we change these terrains that's going to make a difference long term for us and really set us up for success. And so what else can you do right now? So we talked about the toxins already, but there's some nutrition things, some stress things, some sleep, and some movement that you can do right now that's going to help your hormones. And you know, these foundations, like I found that our diet has changed so much that women tend to be under eating a lot of times, and they tend to be under eating protein a lot. So we need protein. We need protein for our muscle. We need protein for our brain. We need it for a lot of things. And so really try to focus on increasing your protein, especially at breakfast, just to stabilize that blood sugar so you're not on that roller coaster ride too. And it also just provides the amino acids for hormone production. So it does impact our hormones. Try to get the ultra-processed foods out. Try to get rid of the fast food as much as you possibly can, because it'll just spike your insulin and it'll put you on a roller coaster ride all day. Increasing fiber, like I talked about, it does bind and eliminate excess estrogen if you've got xenoestrogens. And we do want to use and lose estrogens. It's not that we want them, you know, to be low in our body. We want some, but we want to use it and we want to get rid of it when we're done. And adding high quality fats. That's another thing, is like we got onto this low fat kick for a really long time, and it really wasn't healthy. And so there's a lot of healthy fats out there that will help our brain, will help our hormones. I mean, we need cholesterol to make hormones. So you don't want to be driving your cholesterol down real, real low, like some people like to do. We want to keep it up there because we need it for our brain function and our hormones. And then, of course, we've got to talk about stress management a little bit. It's not that I can control the stressors that come your way, but you can absolutely control how your nervous system experiences that stress. That's where breath work comes in. It's where meditation comes in. It's where having some sort of practice for you comes in, so you have control and you can train your nervous system. You can absolutely retrain it. If you're in fight or flight right now, you need to be in the rest and digest more, but we have to intentionally do it. Otherwise, it won't happen, which is why I love that Numa is here. And then sleep hygiene is a game changer, and it is a non-negotiable, because this is where you start producing more of your hormones at night. You need this restorative time to sleep and repair, and your brain gets the gunk out of, you know, everything accumulates in there. There's this whole lymphatic system that kind of flushes things out when you're sleeping. So you got to sleep enough time in order to get there. And it supports your hormones as well. So those are kind of the key foundational pillars. And then, of course, movement too. Anything that you can do to move your muscles will help your blood sugar control. Women will just naturally lose, I think they said it was 8% of your muscle mass every year, especially in the perimenopause and menopausal period. So we have to do something to build it back. So a little bit of strength training goes a long way. So I would highly encourage that. And that will actually protect not just your metabolism and your hormones, but your bone density too. So again, osteoporosis is a problem as we get older, so we want to make sure we are protecting that too. So these are kind of my non-negotiables. You're welcome to take a screenshot of that, because this is kind of like, if I could just do these things, it's going to make a difference with your hormones within a few weeks. Like, it really doesn't take too much to do it, but it is about prioritizing sleep, eating enough protein, moving, supporting your gut and your liver, really looking, and the way you can do it is with food. Like we do a lot of this is all food first. I mean, that's a whole topic in and of itself. And I also like to do a detox, but just getting at leafy greens, cruciferous vegetables like the broccoli sprouts we talked about. That all helps your detox pathways. Regulating stress, whether you do a breath work session here a couple times a week, or you do some breath work when you get up in the morning before you start your day, it's going to help everything for the rest of your day. And you're just going to be less reactive and more responsive, which is what we're hoping to do. And then limiting the endocrine disruptors. We already have some ideas from tonight of what you can do at home. And those of you who like to track your information, whether you're tracking your menstrual cycle or you're tracking your circadian rhythm and your sleep, I like tracking tools as long as they don't stress you out. So tracking your sleep is pretty cool. And we want it to create alignment and not cause any more stress. So those are the non-negotiables. And if anybody is interested in having some support, so I now am going to be tonight, thanks to Katie and Scott, that we have been talking for a while about to have a program that could help support what you're already doing at Numa. For those of you who are Numa members, that we want to get through the lifestyle piece, these foundational pieces, the internal terrain and the external terrain that needs to be stable before doing anything else, because we can add to any other practice that you're doing right now. So we are going to be launching a coaching program and a coaching membership that if you are a Numa member, you will get a couple extra bonus things with as well. But so, not everybody is ready for this. Some people say, yes, I need something now. I've been spinning in circles. But, this is definitely for you if you're kind of just ready to feel your best and you're tired of listening to the people on TikTok or on Instagram or whatever, and somebody's saying one thing, somebody's saying something else, and you have no idea what you're supposed to be doing because they want you to have this diet or this diet or this diet. That's not the way it is. Again, it's about building this foundation, and this is for sustainable lifestyle changes for you. So we kind of meet you where you are. And because we just want to build that foundation back is very important. And you can have a guide along the way with myself and my health coach when we do this program. And that is something that we are going to be launching now. And even though I know we've already started the month of May, but what I have decided to do is to go ahead and give even the first call tomorrow and then have my health coach do a call for the first 3 weeks, once a week, to get this program going. And so it's going to be a 6-month membership, and you will have a private community as well that will be, it's not going to be on Facebook. It's actually associated with the course that you get as well. So you actually get my Renew the Foundation course at the same time. You get a monthly call with me, a monthly root cause coaching session with the health coach, and any Numa member gets an exclusive coaching call as well once a month in addition to that. And we have ongoing community support. You get the course that I talked about, and you'll get discounts of any future program that's coming your way, as well as professional grade supplements if that's something that you want to pair with it. So that is something that we are starting tonight. And I don't know how many are actually Numa members here, but anybody can be a founding member at this rate, which is going to be $97 a month. It's going to be under $100 a month to have 3 coaching calls if you're a Numa member, 2 if you are a regular member, and all of those other benefits, the course, and the coaching and the hand-holding and walking you through this whole Renew program along the way. So, and that's the QR code will take you to your site.
Yeah, so this isn't it's Numa clients.
It's Numa clients.
Yeah.
I keep saying Numa members. Numa clients, there's 2 different things.
There is, if you want to become a Numa member, and like Parodies, there's a great deal for a Numa membership and a Renew the Foundation membership if you want to have some support in some of the things that Numa offers also. But then there's, if you just wanted to do Dr. Chris's course through Numa, then as long as you're a Numa client, which you now are part of the Numa here, then that's a great way to scan the code and
Right.
that way.
If anybody's wondering about it.
If you're already a Numa member and you don't want to change your membership, whatever your level membership was with Numa, that code will work as well.
Yeah. And so it's just a great first step, because I know a lot of people don't need to work with me one-on-one. A lot of people, I do have discovery calls that I talk to, potential patients all the time. And sometimes I'm like, we can do a lot of this in a group setting. And actually having a group setting is a wonderful community where other people are doing the same thing you're doing. You're going to be sharing recipes. You're going to be sharing experiences. You're going to say, oh, you want that? You missed that? Let's do this instead. So it's just a great support network too. And not everybody needs one-on-one all the time. And again, that is my rate limiting factor for the number of people I can see. But I know we can help a lot of people in a group setting. It's just about education a lot of times. And it's about these little habit swaps that become very big changes down the road that you may not even recognize.